After 3 years, the World Health Organization no longer considers COVID-19 a global health emergency. We'll talk about what this means for pandemic response and vaccinations with CNN Chief Medical Correspondent Doctor Sanjay Gupta. Dr. Gupta, great to have you back on The Final Word. So with the WHO declaring that COVID-19 is no longer a global health emergency, is the world entirely out of the woods, or are we now safe, or is COVID still a threat?
Well, I do think it's some combination of all those things, Rico. You know, it's interesting. For a lot of people, this may seem arbitrary, the idea to end the public health emergency. For other people, they may say, I thought it already ended several months, if not a year ago. I think if you look at the numbers right now compared to when the public health emergency was declared, we're in worse position, like, for example, here in the United States and all over the world. There are more cases, there are more hospitalizations, obviously more deaths compared to the beginning. The big difference is the trends. The numbers have been moving in a good direction in terms of coming down of cases and hospitalizations and deaths. So that's what they're really following. I'll say one thing. We've been surprised by this virus several times. In July of 2021, they thought, okay, here's an opportunity now to really pull back on the protective measures, and Delta hit. By the holidays of that year, it was Omicron. If you talk to scientists, they think there's about a 20% chance that there will be another big variant within the next couple of years. So I think we're in much better position in terms of the trends, but we still have to stay vigilant because of the possibility of new variants.
So stay vigilant with the possibility of more COVID-19 variants, Sanjay. So are Americans still getting themselves vaccinated? Are there still more getting inoculated with the primary doses, boosters, and the bivalent vaccine?
The numbers have really gone way down. I got to tell you, Rico, here in the United States, I think there's been this system now of beliefs that they want to put COVID in the rearview mirror and not think that much about it. So only about 17% of eligible people in the United States have received the bivalent vaccine. 17%. You know, when the original series came out, obviously you had people who were much more likely to receive the original vaccine. But I think over time, as more and more people have developed immunity through infection, because there's been so many people who have become infected in the country as well, that also does provide some degree of immunity, although it can make you quite sick. But I think as a result of that widespread infection, there's been a significant reduction in the number of people who are getting the vaccine now. We'll see. It goes up and down, and people who are older and more at risk are more likely to get the vaccine, but it's still a really low number, underneath 20% here.
And the Philippines, Sanjay, is once again experiencing rising cases of COVID. For those who haven't been vaccinated, how important is it to still receive the primary doses, or for those already vaccinated, still get the booster shots?
Well, you know, you can look at the data around this. First of all, it's really important to sort of have some idea of what is the degree of infection in the country. You know, how many people have had the infection and how recently have they had the infection. So if you've recently had the infection, you are likely to have some degree of immunity. But as with that type of protection and the vaccine, the immunity only lasts 4 to 6 months. So I think what you can say reasonably is that if you have not had some immunity from infection or a booster within the last 4 to 6 months, you should get it again because there's still a lot of COVID out there. We know that people who have received the booster shot, and they're updated on their vaccines, compared to people who have not received the vaccines, they have about a 6-fold protection in terms of death. If you've not had the booster, but you've had the primary dose, you have about a 1.5-fold protection in terms of death. So it does still provide a lot of protection. My parents are in their 80s. They are among the most vulnerable people when it comes to COVID. And they asked me the same question. I recommended that they get their boosters because it had been at least 4 months since they had their last shot. I think people are going to have to sort of look at their overall, their selves in terms of their own infection, their own schedule of shots, and figure that out. but 4 to 6 months is for now a pretty good timetable.
Indeed, those with comorbidities and those who belong to the aging population should get their booster shots. But what if many Filipinos or some Filipinos have already received their second booster shots after 4 to 6 months? Should they receive another booster shot while we still await for the arrival of the bivalent vaccines?
If you look at the difference between the original primary series and the bivalent vaccine did seem to have some benefit, especially given that Omicron was circulating so widely. But it is important to note that the original series, which gives you a lot of antibodies to the virus, is still quite protective. So if you can't get the bivalent vaccine, simply don't have access to it. By the way, in the United States, there's so many doses they can't give them away. So there's some countries that don't have enough, other countries that have too many. But if it gets to a situation where you're worried because of your comorbidities or age, as you said, the original series shots still work very well in terms of providing those protections. Protection against death, protection against severe hospitalization. So, you know, again, I use my parents as an example. I think this is all very personal for people. They're going to be traveling. They're going to be around other people. They still want to get on with their life. Having that added degree of protection, even in the form of the original shots, is really helpful. So I would not discount the effectiveness that can have.
And Sanjay, with the World Health Organization declaring that COVID-19 is no longer a global health emergency, and we know that two of the major pharmaceutical vaccine makers, Pfizer and Moderna, used the mRNA. What is its future beyond COVID, and can it help in other diseases?
Yeah, I mean, you know, it's amazing. I have followed the mRNA story for a long time, and people don't realize that's been a 20-year story. It really came about during the days of SARS back in 2003. So there's two things I would say. One is that how quickly we can make vaccines now, that has forever changed. We used to think about that in terms of several years, and now we know we can make new vaccines in several months. So if there is a new variant, as we were talking about earlier, that is a potential real benefit of mRNA technology. But you know, before COVID, there was this idea that mRNA could actually help in treating certain cancers. It could actually help teach the immune system to fight a cancer that would otherwise be hard to treat. And there's a few trials that we've been following. For example, stage 4 pancreatic cancer. If somebody is given this diagnosis, they're often told, look, there's not a lot we can do about this. Stage 4 melanoma also can be very, very hard to treat. There are now trials going on showing the use of mRNA, again, in a way, teaching your body's own immune system to fight these cancers and finding those therapies to be very effective. So I think beyond the world of vaccines, beyond the world of COVID, the use of mRNA for other diseases, especially cancer, is looking promising. I don't want to overstate it, Rico, because these are still in trials, but I've talked to some of these patients. I've talked to these researchers myself personally, and I think there's a lot of optimism there. Just the way mRNA changed vaccines forever, they may change the treatment of other diseases, some of them forever as well.
Thank you so much for joining us in The Final Word and for your insights on COVID-19. CNN Chief Medical Correspondent, Dr. Sanjay Gupta.